Welcome back to On the Road. In this video, I'm going to show you the most abused prescription drugs. We're going to dive in deeper and get to know these drugs on a more in-depth level by exploring their chemical compositions, their side effects, and how they affect our bodies. Well, let's begin with our countdown. Prescription drugs in the United States. Your favorite rapper or pop singer most likely uses them every day, and some of them might even be in your medicine cabinet right now. Clonopin. Clonopin is the 10th most commonly abused substance in America. Its chemical name is clonazepam, CLZ, and it's highly addictive. 1/3 of people who use Clonopin for longer than a month develop a dependency and get addicted. It's prescribed to both adults and children. Clonopin is classified as a benzodiazepine tranquilizer. In the developing world, it costs between US 1 cent and US 7 cents per pill to develop it on a wholesale scale. You start to feel its effects within an hour. It's prescribed to treat seizures, anxiety, panic disorders, akathisia, movement disorder, and alcohol withdrawal syndromes. It's ironic that this highly addictive drug is one of the medications used to treat substance abuse. Common side effects: psychotic hallucinations, aggressiveness, agitation, memory loss, depression, drowsiness, addiction, poor coordination, increased risk of suicide in depressed people, potentially fatal withdrawal symptoms if stopped abruptly. Clonopin is one of the most abused prescription drugs in the world due to its lasting effects, which can last up to 12 hours straight. Fentanyl. Fentanyl is the 9th most commonly abused substance in the United States. It's the most widely used synthetic opioid in medicine, and it's used with other medications for anesthesia. This very potent opioid pain reliever causes many deaths due to respiratory failure. It's 100 times more powerful than morphine and 50 times more potent than heroin. In 2016 alone, it caused more than 20,000 deaths in America. It's injected, used as a patch on the skin, or as a nasal spray. On a wholesale scale, it costs US 66 cents to produce a 100 microgram vial of fentanyl in the developing world. The company that produces fentanyl is under federal investigation, yet they heavily finance anti-cannabis legislation in Arizona. Common side effects: coma, nausea, sedation, addiction, confusion, constipation, hallucination, poor coordination, low blood pressure, serotonin syndrome. Fentanyl works by activating 1/4 opioid receptors, and its effects last for an hour or two. Because of its rapid onset and lethal potency, it'll remain one of the most abused prescription drugs in the world. Ambien. Ambien's chemical name is zolpidem, and it's the 8th most commonly abused substance in America. Ambien addicts often ingest it with alcohol or other drugs, as prolonged use builds tolerance. The hypnotic drug is prescribed for short-term insomnia and other sleeping disorders. Its effects start working within 15 minutes and make people stay asleep for longer periods at higher doses. Ambien is one of the most abused prescription drugs in the United States. More than 10 million prescriptions are filled in by doctors each and every year. Common side effects: nausea, amnesia, diarrhea, delusions, addiction, hallucinations, headaches, sleepwalking or sleep driving, daytime sleepiness, memory loss, slowed breathing, and heart rate, often led to coma or death. Ambien works by binding to the GABA receptors and increases the GABA effects in the central nervous system. Percocet. Percocet is the 7th most commonly abused substance in America. It's a combination of Oxycontin and acetaminophen, Tylenol. It's an opioid painkiller used to treat moderate to severe acute pain. It's intended for short-term use. Percocet is dangerously addictive, and addicts often snort it for a very intense high. American rapper Future is addicted to Percocets, among many others in the music industry. It's one of the most abused prescription drugs because of its euphoric effects. This makes it very hard to shake, and users become addicted within a month or less. Common side effects: nausea, seizures, addiction, liver damage, low blood pressure, bluish nails and lips, slowed breathing, and heart rate. Respiratory depression often leads to coma or death. Percocet abuse is increasing at an alarming rate among teenage users. Valium. Diazepam, popularly known as Valium, is a benzodiazepine medication that can be taken orally, anally, or injected into the bloodstream. It's the 6th most commonly abused substance in the United States. Valium is prescribed to treat sleep disorders, seizures, muscle spasms, anxiety, restless leg syndrome, benzodiazepine withdrawal syndrome, and alcohol withdrawal syndrome. It costs $0.01 United States dollars per dose to produce Valium in the developing world. When ingested orally or anally, its effects begin in about 40 minutes. When injected into a vein, effects begin in 1 to 5 minutes. Valium chemically restructures the brain to produce a calming effect. When abused, it causes a high that's similar to being drunk, and for many people it becomes habit-forming, and that's why it's one of the most abused prescription drugs in the world. Common side effects: drowsiness, addiction, seizures, agitation, altered sex drive, lowered inhibitions, depressed breathing, increased risk of suicide, poor coordination. After discontinuation of medication, cognitive problems may persist for 6 months or longer. Abrupt discontinuation of medication after prolonged use can be potentially dangerous and fatal. It works by increasing the effects of the neurotransmitter, gamma-aminobutyric acid. Adderall. Adderall is one of the most abused prescription drugs because it induces feelings of invincibility and triples energy and stamina levels in abusers, making the potential to get addicted exceptionally high. It's a central nervous system stimulant classified as an amphetamine, and it's the 5th most commonly abused substance in the United States. It's prescribed to treat attention deficit hyperactivity disorder, ADHD, narcolepsy, and severe depression. It's also used as an athletic performance enhancer and a cognitive enhancer. Adderall use in college students has been steadily increasing since its introduction into the market. Students use it as a study drug for its induced effect of increased wakefulness. At moderately high doses, it induces physical effects such as increased muscle strength, fatigue resistance, and faster reaction time. It also acts as an aphrodisiac and induces feelings of euphoria. Common side effects: tremors, insomnia, numbness, seizures, dry mouth, addiction, aggression, blistering, convulsions, coma or death, loss of appetite, cardiac arrhythmia, rapid muscle breakdown, psychosis, delusions and paranoia. Adderall's main active ingredient is an amphetamine, and it works by increasing the activity of the neurotransmitters, norepinephrine and dopamine, in the brain. Suboxone. Suboxone is a combination of buprenorphine and axolone. It's used to treat moderate to severe pain, and it's the 4th most commonly abused substance. Ironically, this synthetic opioid began as an addiction recovery drug, used as a treatment for people addicted to actual opioids such as heroin. The risk of overdose with Suboxone is lower than with other opioid drugs. It's available for use in 2 different ways, either by placing it under the tongue or on the inside of the cheek. It's the #1 drug bought and sold illegally in US jails and prisons. It's one of the most abused prescription drugs, as it provides abusers with a mildly euphoric high that lasts more than 48 hours. Common side effects: dizziness, addiction, memory loss, small pupils, extreme drowsiness, low blood pressure, cognitive impairment, slowed breathing, respiratory depression, possible death. Because Suboxone's high is less potent than other opiates, abusers often use it with alcohol and other drugs. Vicodin. Vicodin is the combination of hydrocodone and acetaminophen. It's also sold as Lortab or Norco, and it's the 3rd most commonly abused substance. It's an opioid pain reliever that's as potent as morphine, and it's used to treat moderate to chronic pain. Vicodin is highly addictive and easy to overdose on. It's one of the most abused prescription drugs in the United States, as abusers experience a very intense feeling of euphoria and an altered perception of pain. More than 16 million prescriptions of Vicodin are made every year in America, and according to the Drug Enforcement Agency, (D), it's the 2nd most encountered opioid drug found in submitted evidence. Common side effects: fear, anxiety, headaches, dizziness, addiction, constipation, muscle limpness, rash and itching, low blood pressure, nausea and vomiting, low blood sugar coma, inability to urinate and bladder spasms, hearing impairment or permanent hearing loss, impairment of mental and physical performance, slow heart rate and breathing can lead to death, somnolence, extreme sleepiness can progress into a coma, liver and kidney failure, sometimes resulting in transplant surgeries or death. Just like other opioid prescription drugs, Vicodin causes serious withdrawal symptoms that can be potentially fatal, making it difficult for users to stop taking it. Xenax. Alprazolam is a medication of the benzodiazepine class, and it's more popularly known as Xenax. It's the second most commonly abused substance in America. Xenax is a potent hypnotic and sedative used for the treatment of social anxiety disorder, panic attacks, insomnia, anxiety disorders, and generalized anxiety disorder. Because of its fast rapid onset and long-lasting effects, Xenax will remain one of the most abused prescription drugs in the world. It's the most prescribed and misused benzodiazepine in the United States. Tolerance for Xenax develops in just a few days of taking it, prompting users to take more and more of the prescription drug, eventually leading to addiction in a very short amount of time. Common side effects: amnesia, increased risk of suicide, blackouts if taken with alcohol or grapefruit, potentially life-threatening withdrawal symptoms, just like the other benzodiazepines on this list. Xenax works by depressing the central nervous system, inducing a calming and sedative effect. Oxycontin, Oxycodin. Finally, we made it to the number 1 spot on our countdown. Oxycontin, also known as Oxycodin, is an opioid drug used for the relief of moderate to severe pain, and it's the most commonly abused substance in America. Oxycontin's ability to produce a very intense euphoric heroin-like high makes it one of the most abused prescription drugs in the world. Oxycontin currently drives the opioid epidemic in the United States. Even at regular doses, it slows down breathing, and users can become physically and psychologically addicted to the drug within a month. Addicts usually crush, chew, snort or inject it to obtain a more potent high all at once. It was originally intended to help late-stage cancer patients cope with pain, and it's more than 100 to 500 times more potent than morphine. Common side effects: itching, sweating, dizziness, dry mouth, addiction, somnolence, constipation, nausea and vomiting, low blood pressure, respiratory depression, circulatory collapse, respiratory arrest, potentially fatal withdrawal symptoms, death. Oxycontin targets 1/4 opioid receptors in the spinal cord and the brain. There you have the top 10 most abused prescription drugs in the United States. If you found our video informative, please share and comment. Also, don't forget to subscribe for more awesome content. Remember, this is On the Road.